So until now, myeloma patients were stratified according to the revised ISS system, and high-risk cytogenetic in this system is deletion 17p, T414 or T1416. Then we had the revised 2 ISS, where high-risk cytogenetic is deletion 17p, T414 and 1q gain. But in this era of triplet and quadruplet treatments, we felt that these traditional cytogenetic factors capture no longer accurately the prognosis. So we decided with the IMS to have this workshop 1 year ago, more than 1 year ago, in Barcelona. And it was the opportunity to define a consensus. So we had hot debates about this consensus, but at the end of the day, we have a consensus, and this is the following statement. So a high-risk patient now is a patient with a deletion 17p in more than 20% of plasma cells, or a patient with a TP53 mutation, or a patient with a biallelic deletion 1p32, biallelic deletion 1p32, or an association between intermediate factors, which are the so-called high-risk IgH translocation, T414, T1416, T1420, plus 1q, or plus monoallelic deletion 1p32. In fact, these factors are not considered anymore as high risk by themselves. They are often associated with each other, and now this association is considered as a high risk.